Revealing new information on the power of the Delta variant, the internal CDC documents with some sobering news for vaccinated people.
Disneyland's new indoor mask mandate takes effect as the Disney company as a whole clamps down on workers.
Everybody was trying to convince him he didn't want to do it.
And a local husband now fighting for his life and regretting his decision not to get vaccinated.
ABC 10 News at 6 starts now.
The war against COVID-19 has changed. Good evening. I'm Kimberly Hunt.
And I'm Steve Atkinson. The headline you may have heard this morning is that the Delta variant spreads as easily as the chickenpox. But tonight, our ABC 10 News anchor Derek Stahl goes in depth on what was in this study that convinced the CDC we all need to mask up again.
An internal document from the CDC shows Delta is unlike any COVID variant we've encountered so far, spreading several times faster than the common cold or the flu. On average, one person with Delta will infect 5 to 10 other people, on par with chickenpox. One case of the original version of COVID tended to spread to 2 to 3 others. The agency also said Delta is likely more severe than previous strains, based on data from other countries.
This data show that the war against COVID has gotten harder because the enemy has gotten smarter.
UC San Diego's Dr. Navaz Karangia says the report reveals vaccines have held up well. The risk of hospitalization and death was 25 times lower for the vaccinated. The risk of getting infected at all was 8 times lower for the vaccinated. But that means so-called breakthroughs are happening. There are about 164 million vaccinated Americans, and the CDC estimates at current levels, 35,000 vaccinated people will get sick with COVID each week.
It does convince me that wearing your mask indoors is the right thing to do right now to protect folks, especially the immunocompromised and children who can't get vaccinated.
The CDC says in some cases, vaccinated people can spread the virus just like the unvaccinated. That's based on data from places like Provincetown, Massachusetts in Cape Cod. During the town's boisterous 4th of July party scene, there was an outbreak. 469 people tested positive in just a 2-week span, even though 74% were vaccinated. 274 vaccinated people wound up getting sick with symptoms, but only 4 of them were sent to the hospital, and all survived.
If you do get infected and get symptomatic with the Delta variant, then you are able to transmit it to other people about as easily as people who are unvaccinated. But remember, the number of people that are going to get infected and symptomatic if they're vaccinated is much lower.
Dr. Karangia says the most important number in the CDC report is that vaccines are still preventing more than 90% of severe disease. Derek Stahl, ABC 10 News.
The document hints that the updated guidance this week on masks may not be enough and that other social distancing restrictions, that is, may be needed to combat the Delta variant. The county is reporting our highest one-day case number since early February. There were more than 1,200 confirmed cases in San Diego County yesterday. The one piece of good news, there were no reports of any new deaths.
As COVID cases spike across the county, local hospitals are gearing up for the surge in new patients. ABC 10 News reporter Jennifer Kastner is live outside Scripps Encinitas, where the ER is full again. Jen?
Yeah, that's right. I spoke to the chief medical officer and she said that the surge tents are already being used. And then just about an hour ago, workers left that Arctic style tent back there. That was just put up this afternoon. We're told that the ER is packed. It is filled with all sorts of patients, not just COVID patients, possibly people who delayed treatment in the winter or in the spring because of the pandemic. At all of the hospitals that are part of Scripps Health, providers are now seeing a greater volume of COVID-positive patients.
We are definitely gearing up for what might be increasing cases.
Chief Medical Officer Dr. Ghazala Sharif told ABC 10 News that plans are underway to address the fast surge.
The rise in cases is what's concerning. Right? We can handle the load, but the fact that it's going quicker and quicker, we're up to 84 patients in-house at Scripps. 14 of those are in the intensive care unit. And then we have between a 12 and 17% rate of patients who have been vaccinated who are also being admitted.
The hospitals are bringing back negative pressure rooms to keep air contained and decrease potential spread of infection.
We want to make sure that we get ahead of the game here and just be ready for any patients that do have to use those rooms.
Some of the outdoor tents are being reintroduced and visitor policies are being reconsidered. Non-COVID patients have been allowed limited visitors, but that may change. Then there's the issue of staffing.
Our biggest concern right now, as it is across the region, is staffing. There's a lot of people not only taking time off, but people are tired.
Certain procedures may be limited if staffing continues to be problematic. Surge planning is happening at other local hospitals. Sharp Healthcare wrote in part, Sharp Healthcare is reviewing all aspects of the care continuum, such as airborne isolation capacity, surge capacity, and adequate staffing levels at all its facilities. Officials at Kaiser wrote in part that they're closely monitoring the COVID positivity rate, and we have retained expanded capabilities so we can quickly increase treatment space, staff, and supplies to manage smaller, localized hotspots or large surges across our system. And again, you are getting a live look tonight at the big Arctic-style overflow tent that was just put up a few hours ago here outside of the emergency room at Scripps in Encinitas. We also reached out to Palomar Hospital, which had the federal overflow facility. They said that all of the COVID beds were put back into storage months ago. They were hardly used during the height of the pandemic, and they are far away from any discussions about bringing those beds back into use at this time. Reporting live from Encinitas, Jennifer Kastner, ABC 10 News.
Thank you, Jennifer. A new study found some people with breakthrough COVID cases had lingering symptoms for weeks. Here is an in-depth look at the findings. The Israeli study, published in the New England Journal of Medicine, showed out of nearly 1,500 vaccinated healthcare workers, just 39 or 3% were infected. But of the infected group, nearly 1 in 5 developed symptoms that lasted at least 6 weeks. Their symptoms included headaches, muscle pain, loss of taste and smell, and fatigue. One of the authors of the study called the findings concerning. Dr. Peter Chin Hong said, despite the sample being small, the research is concerning because of the type of variant that was studied.
It is concerning, on the other hand, because it is the alpha variant that was primarily studied. Delta may actually have higher viral loads, and that may lead to people having chronic symptoms, a long hauler syndrome.
Of the 39 people infected, just 1 had pre-existing conditions. The rest were healthy. But most of the people who got sick had mild symptoms. None was hospitalized. The authors say the results need to be confirmed by additional research involving more patients who are followed longer.
Disney is requiring all of its workers in the U.S. to be vaccinated against COVID. Employees who aren't will have 60 days from today to now comply. This comes on the very same day Disneyland began requiring all visitors 2 and up to wear masks indoors at its theme parks, regardless of their vaccination status. Reactions from park visitors, they were mixed.
Safe for our family and also safe to others too. So wearing a mask is very important.
We weren't happy about it. I mean, we're from Arizona, so we kind of Wild West out there. We don't even wear masks anymore.
The mask mandate applies at the entrance to many of the park's attractions and enclosed vehicles such as shuttles and buses. The face covering that must fully cover the area from the person's nose down to their chin. You can stay on top of any new developments with coronavirus by downloading the 10 News app. A free version is available in the App Store.
It appears San Diegans are ready to recall Governor Gavin Newsom. In our scientific ABC 10 News Union Tribune poll in San Diego, 49% believe Newsom should be recalled, while 40% think he should stay in office. 11% are not sure. As for who should replace Newsom, among the San Diego respondents, 28% are undecided. Democrat, YouTuber, and real estate broker Kevin Paffrath leads the pack at 20%. And Republicans split the rest of the field, with former San Diego Mayor Kevin Faulconer tops at 18%, followed by Larry Elder and John Cox. Another candidate is throwing their hat into the ring to replace Councilman Chris Cate. Republican Christina Carter Nichols announced her candidacy for the District 6 seat today. The San Diego native is a mom and holds an MBA. She is the third candidate to declare for the seat. Cate, the lone Republican on the San Diego City Council, is termed out next year.
We now know the name of the man killed in a violent crash in La Mesa. This was the scene on Wednesday after a driver in an SUV careened through a parking lot and into that office building on University Avenue. A man inside that building was killed. A medical examiner identified him as Braden Jockman. The driver was injured but is expected to survive. Investigators say that drugs or alcohol, they may have played a role in that crash. The search for a missing woman has turned into a murder investigation. Police got involved when a 48-year-old Fabiola Calderon didn't show up for work yesterday. After investigating further, officers arrested her boyfriend, Nery Garcia. Detectives say they believe they have located Calderon's body, but they're not elaborating any further on this story. Anyone with information on this case is asked to call the San Diego Police Homicide Unit.